Hello, Jameson Spencer here. Welcome to this on-demand program where I will reveal the very best oral appliance and how to have the least side effects and how to get maximum ROI. Again, welcome. I hope that you are having a wonderful summer, and for my friends down under, that you're having a wonderful winter. It's that time of year again where we open up enrollment in Spencer's Study Club, and as usual, I wanted to put together some good content for you, and hopefully you'll get something out of that. And then I will talk about Spencer Study Club, and if that looks like something that might help you, help more people, then I'd like to welcome you aboard. My goal is to add 100 million years of life lived with vitality to this planet. Now, that may sound ambitious, 100 million, that sounds like a lot, but actually how I get there is I help 10,000 dentists like you, each help 1,000 of their patients live an additional 10 years with vitality. Not just live an additional 10 years, but 10 years with vitality. And so I put together Spencer Study Club to help do that, and to help do that with people all over the world, people who couldn't necessarily travel for courses and things like that, and people who can travel but just want to get maximum value out of their continuing education dollar. So I won't spend any time, introducing myself. If you're getting this, you've probably seen me at some course before. If you want to go to jamesonspencer.com and check some of that stuff out, that's cool. But let's jump right into our content. So the first thing I want to talk about is the best oral appliance, the very best oral appliance. And I get asked this all the time. Everywhere I lecture, someone usually within the first few minutes of the lecture will raise their hand and say, Jameson, what's your favorite appliance? And that's another way of saying, what's the best appliance, I hope, because they probably think, well, you've been doing this for 22 years, actually 24 years, excuse me. You've been doing this a long time, and probably now you've figured out the best oral appliance. And then I kind of take them through a few different things of how I look at oral appliances and how I have differentiated oral appliances over the years to kind of help me help more people. And there are so many oral appliances on the market, well over 150 different FDA-approved oral appliances for snoring and sleep apnea. So how do you make sense of all these different things? And you may hear of somebody using something and someone using something else, and it's sometimes rather confusing. So I want to break that down for you to make it relatively easy, because all oral appliances do the same thing as far as those that are used for treating sleep apnea and snoring. They anchor to the maxilla and keep the lower jaw from falling back or bring it forward in some manner. Now, that little phrase I just said there is rather important, and that's how we talk to our patients in our practices as well. Oral appliances keep your lower jaw from falling backwards and bring the jaw forward when necessary. And this is kind of like CPR. With CPR, it's head tilt, chin lift. The reason dentists are involved in treating sleep apnea is because the tongue and other muscles attached to the jaw, the lower jaw, the mandible. And as we bring the mandible forward, that has a positive effect on the airway. As a matter of fact, here is my airway. This film was taken a long time ago and is with an appliance in my mouth that actually no longer is on the market. But on the top here, you'll see my airway looking down on it, and here we are from the side. And then, there's with my teeth together. Here, with the Tap 2 appliance in my mouth, you see the change in the airway from a AP standpoint, but then also from a lateral standpoint. Now, granted, that is sitting up awake in my cone beam CT machine at the time, but this is just to give you an idea. Again, all oral appliances work in a similar fashion in keeping the jaw from falling backwards or bringing the jaw forward a little bit. So years and years ago, I started looking at the appliances and saying, okay, so they all do the same thing, but some do it differently. So there's a mechanism of action of each oral appliance. There's a different way that it attaches to the maxilla, that it anchors to the maxilla. And could I break these down to make it a little more simple, rather than just kind of brand names and things like that? And you're like, well, I don't know the difference between a tap and a dorsal fin or a clearway or whatever. to break them down into mechanism of action. That's one of the things I try to do in teaching others, is make more complicated things less complicated, making things more simple so that you can not only wrap your brain around it, but also help your patients to understand what's going on and what you're doing. So let me break these down by mechanisms of action of how I look at this. So we have first our anterior pull-push, and these have a mechanism on the upper that is in the middle, in the midline, and bring the jaw forward from there. Now, why do I call it pull-push? That's weird, right? So let me explain that. It is pulling, depending on your overjet, pulling up to edge, and then we basically push beyond there. So the analogy I use when I'm lecturing, which you may have heard me say before, is if I was to lasso somebody in the back of the room and I wanted to get them to the wall behind me, I would pull them to me, and then I would have to push them beyond there. So that's why I call it a pull-push. And these are appliances. The TAP appliance is the most famous pull-push, anterior pull-push appliance. Next, we have our push appliances, and these are usually referred to as Herbst appliances because of the Herbst hardware. These will anchor in the posterior aspect of the maxilla, and then using rods, then push further forward on the mandible. Next, we have our pull appliances. So these will anchor in the canine premolar area, so more anterior area, and then have a strap that goes back on the mandible to pull it forward. Next, we have our adjustable monoblock appliances. And by the way, so our pull appliances, this would be appliances like the EMA, the Silent Night, appliances you've seen before. Our adjustable monoblock appliances, these are usually a fixed appliance. The patient can't move in any direction, and they'll have some sort of mechanism to bring the jaw forward. The Moses appliance is a famous adjustable monoblock appliance, and there are several others, like the Clearway, for example, is one of the first appliances of that nature, PM positioner. Then we also have our interlocking appliances. The interlocking appliances have wings of some sort that interact with each other. So this would be like a prosomnus appliance, as pictured here, or a dorsal fin appliance, which was one of the original interlocking style appliances. And then they will typically have a mechanism to bring the jaw farther forward. The prosomnus device has different trays that you trade out in order to bring the jaw forward. Dorsal fin appliances have a little jack screw that brings the jaw farther forward. And that is really your 5 mechanisms of action: anterior pull-push, push, pull, adjustable monoblock, and 5th, interlocking. Then the last one on my list here is temporary or trial appliances, but all of those will fit into one of these 5 categories of how does it attach or anchor rather to the maxilla to keep the lower jaw from falling backwards, or when necessary, bring the jaw farther forward. So I hope that's helpful to you, that any course you go to or any advertisement you see or whatever, you can now quickly differentiate, okay, so this appliance is like other pull appliances. This is like a pull-push appliance. This is a push appliance. This is an interlocking appliance. And then you can kind of get into, all right, well, what makes this one special? Is it different materials? Is it have other aspects to it that are unique amongst that class? But once again, all oral appliances anchor to the maxilla, keep the lower jaw from falling backwards, or bring it forward a little bit. And these are some of the things that we consider in our practice when we're deciding what appliance to select for the patient and getting the patient's feedback to help us in this selection process. So you see a couple that I have on the screen here as bolded. The reason those are bolded is because they're very important. Now, frankly, all the things on this list are important, but these are things that I see a lot of my dental colleagues miss on a regular basis. Frankly, a lot of education in dental sleep medicine is put on by industry. It's put on by companies. And if they have a style of appliance, which has happened over the years, that let's say a dorsal fin type of an appliance or something like that, they taught their appliance, which makes sense, right? And because of that, a lot of dentists get into this method or this mode where everybody gets the same appliance because that's what they learned. They learned that appliance, So they give it to everybody. And there's a few appliances you can kind of get away with doing that. So interlocking type of appliances, push type of appliances, the Herbst type of appliance, they'll work on darn near anybody, as I'll go through this list here in just a minute. But the problem is there's some people that they don't work well on, and if you're only using one style of appliance, then that can potentially cause the patient some pain and other side effects, and ultimately result in them giving up on treatment, which of course is the worst case scenario here. So let's go over some of these. So the first thing I have on the list here is lateral bruxer. Now, wear on the teeth, wear patterns don't mean currently that that person is clenching or grinding their teeth, but it gives us a historical context of at some point, and maybe still now, that patient has been a lateral grinder. When you see the canines worn off, the cuss tips on the premolars worn off, you had a pretty good idea that at some point in the past, and maybe still, that person is grinding laterally. So if you have a patient that is a lateral bruxer, I like to give that patient an appliance that allows lateral movement. So for example, options for that might be a pull-push appliance, most of them, a push style appliance, Herbst style appliances usually are got lots of room for someone to move side to side. Pull appliances are excellent choices in this case, whereas our monoblock may not be the greatest choice, or a traditional interlocking may not be the greatest choice in someone who has lateral bruxism. The one that's pictured on your screen here, Prosomnus, actually that company allows you to push those fins laterally because of the CAD-CAM design. So actually you could use that in someone who has evidence of lateral bruxism that you think may be ongoing, just communicating with the lab. But be careful on appliances that don't allow the person to move at all. Now, you may have heard me lecture on this before, or you may have heard others lecture, that bruxism is often related to airway issues. And therefore, in some cases, when the airway is protected using oral appliance therapy, or CPAP for that matter, a person's bruxism may reduce or even go away. And that's true. I've seen that over and over and over again. But here's my paradigm. I plan for the worst and hope for the best. So if the person has evidence of historical lateral bruxism, I'm going to give them an appliance that allows them to move laterally, and then hope that by protecting their airway, the bruxism behavior stops. Okay, so that's lateral bruxer. I'm not going to spend as much time on every one of these, but just kind of spend a little bit more time on that one, because that is by far the biggest error, if you will, I see out there of patients that come to our office having already been fit with an oral appliance, and they're having pain or issues, or they didn't like the appliance for some reason, and that is usually the problem, is they were given an appliance that does not allow them to move laterally, and they are still moving laterally. Okay, desire to keep their mouth closed, and then the next one, desire or ability to open their mouth. Now, those are contrasts to each other, right? So this is something I learned through experience, like most of the things I teach. I had a patient who said, hey, I sleep with my mouth open. So I chose an appliance for that patient that would allow him to sleep with his mouth open, like a push-style appliance that easily someone can open their mouth, or an interlocking appliance where they can easily open their mouth. And the patient came back and he's like, well, this doesn't work. I said, well, why not? Because I sleep with my mouth open. And I was like, oh, so you mean you didn't want to sleep with your mouth open? Yeah. It doesn't work because I sleep with my mouth open. I need something to keep my mouth shut. Oh, so then I fit him with a anterior pull-push appliance, which is great at keeping the mouth shut. Now, some of these other designs, you can also use elastics to keep the mouth shut, things like that. But I wasn't good enough then to pick up on what the patient was trying to tell me. And then the next time it happened, the person said, I sleep with my mouth open. And I was like, okay, cool. I'm going to give you an appliance that keeps your mouth shut. And the patient came back and said, I can't sleep with this in because it doesn't let me sleep with my mouth open. And this person was very claustrophobic, had some PTSD, and couldn't use it. So I've learned, when having that conversation with patients, to ask, do you want the ability to open your mouth? Or would you prefer that the appliance helps keep your mouth shut? Okay, so consider asking your patients those questions. Retention issues. So usually the problem here is going to be they have short clinical crowns and there's not enough retention, so you need to choose your appliance wisely there, because appliances that are attached top and bottom in some ways are harder to, they need more retention Otherwise, they just pop off. For example, an anterior pull push appliance needs pretty good retentive features on the teeth. Otherwise, that patient opens and it comes right off their teeth. Missing teeth. I really like pull appliances. So this one right here is one of my favorite appliances. Nevertheless, if somebody is missing lower posterior teeth, can't use it because there's nothing to anchor there and it will just pop off. Restorations or future restorative come into consideration because if they are having crowns or a bridge or something else placed or an implant, you might choose maybe a less expensive appliance to use in the interim while they are getting that restorative work finished. Or you may choose an appliance maybe with a soft liner that can be easily modified by adding acrylic after that dental work is performed. The distance the patient has to travel and ability to return for follow-up are similar. We will choose appliances based on this because some appliances require a little bit more follow-up. Some appliances are a little more robust or have less moving parts, less things to break, and so we might use appliances like that for our patients that are distant to our practice. For example, our Boise, Idaho practice went to Anchorage, Alaska for, I think it was 7 years, and we used different appliances in Anchorage than we did in Boise because our Anchorage patients obviously were not able to just bop into our office if they needed new bands, for example, for their EMA appliance. Manual dexterity and vision. Now this is a little bit of a joke, but it really isn't. But of all the appliances on the screen right now, if you gave me the job, hey Jameson, we want you to come up with an appliance that is difficult for people with poor dexterity to use and almost impossible for people with poor vision to see how to adjust it, I would come up with this appliance right here, which is the push appliance or the Herbst appliance. And the reason that's a joke is because that happens to be one of the two designs that's covered by Medicare. So these are appliances that we give our Medicare patients because we are forced to. There's no evidence to support this. There's no basis of it other than kind of a whole story that goes along with it. But it's difficult for people with poor manual dexterity or poor vision to use that appliance, whereas something like this interlocking appliance here, which is changing out trays, could be far easier. Metal allergies and sensitivity, another bolded one. I mentioned the Medicare appliance here, so all Herbst appliances have metal bars. There's no Herbst appliance on the market as of yet that doesn't have metal bars. And if your patient says, hey, I'm allergic to metal, I'm sensitive to metal. Back in the olden days, I used to try to fight that battle. And I would try to convince them that they really weren't allergic. Tape the metal to their inside of their arm, have them wear it around for multiple days and see if they had a reaction, and they never would. But after a while, I decided, I don't want anything to make this patient think that it's not going to work for them. And heaven forbid you give them an appliance that has metal in it and then they develop a canker sore or something. And then they're like, yeah, see, I told you I'm reacting to this. So if a patient tells me that, we will give them an appliance that does not have metal in it, which in some cases means going outside their insurance because their insurance only covers one thing and they want something else. So you have to do what is appropriate in that case. By the way, usually insurance companies don't care about my patients sensitive to metal. They won't change their rules, so you have to be careful with that. Prior experience with oral appliance therapy. This is another one learned through lots of experience. I once had a patient that came in the office with an appliance that I really didn't like, and I didn't want to use it. And so I gave the patient a different appliance that I liked better, and guess what? Patient didn't like it. So we ended up making him one like he had before. Had another patient who had come in from another dentist and was fit with a very fine appliance. It was very functional and the patient really wasn't having problems with it, but they kept saying they didn't like it. Upon more conversation with the patient, it turns out that it was the dentist the patient didn't like. Not really the appliance, but the patient was putting all of that discontent with the dentist into the appliance. So I made her a different appliance, which she loved. Well, actually, it was more about my staff and myself and the interaction that we had with her that she loved, but she connected this with the appliance. So be careful with that. When they've had an excellent experience, never again will I make somebody a new appliance if they've got an old appliance that's still on the market, that we can just make them a new of what they're used to. And as well, if somebody's had a negative experience, I wouldn't try to be like, well, I'm sure I'm better than the last guy. Let me give you exactly what they gave you. I wouldn't do that either. And then last is current history of TMJ problems. Now, this is not, I repeat, not a contraindication to oral appliance therapy, although some think it is. And actually, the FDA, all of these FDA-approved appliances will say right in their paperwork that you're not supposed to use their oral appliance if the patient has a TMJ problem, whatever that means. But in my experience, as a guy that is practice limited to TMD since 1998, since I came out of dental school, we find every single day that a lot of patients that come in to see us for a TMJ problem actually have sleep apnea. We refer them for sleep studies. They get diagnosed with sleep apnea. Oftentimes they're put on CPAP and their TMJ problem gets better. If they are sent back to us for an oral appliance, we are never hesitant to treat patients with an oral appliance for their sleep apnea if they have a TMJ problem. However, helping the patient understand this isn't going to make their TMJ problem worse is very important. And we may choose an appliance, for example, this pull appliance that has the elastic bands that are a little stretchy, a little forgiving. We may choose that in such a patient to help them understand that this appliance will break before they break. So what is the best oral appliance? Let me reveal that now. And you probably already picked up on it. The best oral appliance is the one the patient will actually use. Now, that may sound trite, and it is absolutely not. It does not matter what magical material the appliance is made out of, or what magical properties it has, or what magical things that it does, if the patient won't wear it. And I've seen this over and over and over again, that dentists make this more about the plastic than they do about the care for the patient. You need to match the appliance with what is going to help the patient the most. And nothing else really matters if they won't wear it. So that is your quest, is to get good enough in communicating with your patient, knowing the available appliances on the market, these 5 different mechanisms of action and different appliances within each of those categories, to then figure out, okay, this patient has a smaller mouth, they have a hard time closing their lips just in their normal vertical dimension. So if I put something between their teeth that opens them up much, they aren't going to be able to close their mouth at all. They've got short clinical crowns. What can I give them that they'll actually be able to use? That will be the best appliance for them. It doesn't matter how much it costs, or how little it costs, or how long it lasts, or how little it lasts. It matters if they'll actually wear it. Once you've got that going on, then actually you might even change appliances over time as they get used to having something in their mouth. As a matter of fact, if they've worn a night guard before, you can use that to your advantage because they will have experience with having something in their mouth, and you can learn from that. What was it about your night guard, or what is it about your night guard that you like? What is it that you don't like? And go from there. The best oral appliance is the one they'll actually use. Okay, now let's talk about the least side effects and how can we have the least side effects. And this goes, sometimes people think, well, this is an appliance related issue as well, but not really sure that it is. It's more about diagnosis of the patient prior to starting the oral appliance. And I want to talk about the most common side effect and how we can avoid that. So here are the videos from Dr. Wesselson and Erickson showing the jaw joint and internal derangements. So here in the upper left-hand corner, we have our normal jaw joint. So that is the disc here, fat, skinny fat, the condyle, articular eminence, and the fossa. And note the space here above the condyle when that person is in occlusion. There is so much space above the condyle, and the disc has plenty of room to be between the condyle and the articular eminence and the fossa. Whereas as we move to the reducing disc displacement, so here's the condyle, articular eminence, and fossa in the disc. Squirt, out it pops. as that person goes into occlusion, and we have basically no space at all between the condyle and the top of the fossa upon closure. Again, here the disc pops out of place, and then as the person opens, it goes click into position. Our patients do not understand that their jaw is popping into place. Just this morning, I was at kind of a workout facility, and the trainer that was there asked me as we were going through our stuff there, she says, "Hey, I need to talk to you sometime about my jaw because I have TMJ." And I finished up my stuff there, and I'm like, "All right, let me check out your jaw joint." She had a reducing disc displacement bilaterally. Very loud click, very early click, which is good on both of those two things. And so I explained to her, I said, "Hey, when you open and it goes pop like that, that's you going into the right place." And you could tell, as happens every time we have this discussion with our patients, that her mind was blown. She thought her jaw was popping out of place. So understanding that, you first and your staff, and then being able to explain this to your patient will be critical. What about people with a non-reducing displacement? Here we have the disc out of place anterior to the condyle, and it never pops back into place. It's always out of place. And then lastly, we have a degenerative joint disease problem. So with a oral appliance therapy for sleep apnea, when you're treating someone with an anterior disc displacement, you're going to be holding their jaw forward a little bit, and their jaw will be stopped right about there with your oral appliance in place. In a non-reducing displacement, same thing. Their jaw is going to be held down and forward using this oral appliance. Well, in the case of a reducing displacement, this is a better position for their jaw. It's better. In the morning, that person has to dislocate their jaw to get their back teeth to touch again. With a non-reducing disc displacement, usually that will stay non-reducing, but every once in a blue moon, you'll have a patient who will start clicking again, who will start going back into reducing disc displacement. And indeed, they could also develop a posterior open bite because of the change in occlusion. So why is this change in occlusion happening? Because the condyle is in a different spot now. When the condyle comes down and forward like that, the posterior teeth open up. So the number one side effect that is easily avoidable with oral appliance therapy is a posterior open bite. Now, there's a couple of reasons this is the number one side effect. The biggest reason is because people don't really think about their bite in the first place. Just last week, I was doing a course. I'm blessed to be involved with the U.S. Army, training their dentists. And we had a day where we brought in actual patients, soldiers who were being treated with oral appliance therapy. And one of the patients, a young man, talked about that he didn't like the feeling of getting his back teeth together. He bit out on his front teeth. Think about that clinically, my dental professionals here. When you ask a patient, which you do on a daily basis, go ahead and bite down for me, how often do they bite on their front teeth? So people, normal people, non-dentists, don't think about their occlusion. And so it's very easy for them to lose their posterior bite because they never think about it in the first place. As a matter of fact, try something with me here. So go ahead and swallow. If you got a drink there or something, just go ahead and take a little sip of water or something, or just your saliva, and swallow like you normally would. Okay, I just put my back teeth together to swallow, stabilizing my mandible. Now, what I want you to do now is try to swallow without putting your tongue to the roof of your mouth or your teeth together or bracing your mandible in any way. So just kind of have your jaw agape and swallow without stabilizing your mandible. That is very difficult to do. Now, try one more thing. Put your front teeth together and swallow. Now, for most of us, that's easy. Once we stabilize that mandible, we can swallow relatively easily. So I believe this is one of the reasons that people with oral appliance therapy will develop a posterior open bite is they just don't know. As a matter of fact, in, again, 24 years, is that what I said before? Yeah, 24 years since 1998 of treating people with sleep apnea and TMJ problems, it has been extremely rare, like count on one hand rare, the number of patients who come in and they have noticed that their bite has changed, other than those who are doing what I'm about to tell you. The vast majority of patients, particularly historically, before we ever used to think about these things, and we treated thousands of people before we really started taking these side effects seriously, the people back then who would come in with problems, their dentist or their dental hygienist are the ones that notice the side effect, not the patient. Okay, so how do we avoid this? All oral appliances do the same thing. They anchor to the maxilla and keep the lower jaw from falling backwards or bring it forward. So all oral appliances can result in this posterior open bite because they are all doing the same thing. So what we need to do is get the jaw back to its normal habitual position, into maximum intercuspation, into habitual occlusion. So morning repositioning. And I refer to this as the morning reprogrammer. Now that term reprogrammer, I made up that term, and that is to differentiate with a deprogrammer. A deprogrammer, what's the program? The program is our bite, how our teeth come together. A deprogrammer is used to deprogram those muscle engrams, let the jaw kind of go where it wants to go. A reprogrammer is designed to take the jaw back to maximum intercuspation. Here's my philosophy on this. If the patient came in without really a occlusal problem, so to speak, they're doing okay with their occlusion so far, and they're 45 years old, why should I screw that up? So I don't think we need to. I think we can keep people in their habitual occlusion using this technique. So this is something that was developed by multiple friends of mine, and I contributed some of these things to it too. But really, we believe that we've kind of narrowed it down now that if you do what I'm about to describe, and with this extra special part that I've never really publicized before, except to our Spencer Study Club members, I don't think you need to have patients have bite changes anymore. If they will do these things, it is extremely rare that they'll have a bite change. So here's your armamentarium. Get yourself some Thermacryl Plus from Airway Management. That's the company that makes a tap appliance. And here's some of our Thermacryl beads. We get a tongue depressor that we're going to use to get them out of the boiling water. And then here's some shim stock. The shim stock is there as a reminder to check their occlusion, their posterior occlusion, before you do anything. So we want to document if that patient already has a posterior open bite, or if they don't have contact between all their posterior teeth. So we'll use shim stock to check their bite, and also use shim stock to make sure that our morning reprogrammer is actually working. So here's how we go through here. So we check the bite in advance with the shim stock on both sides, obviously, making sure that our patient has posterior contact. Then we pour some boiling hot water in our cup here and use our tongue depressor to get that. Here we have it just kind of on the stick just to kind of continue to warm it up back in the hot water. Then we form it into a Jolly Rancher type of shape and then stick it on the lower anteriors. Then we're going to have the patient just simply close down and push with their tongue a little bit to give it more impression of the linguals of the upper teeth. We do not roll this material onto the facials of the upper front teeth because we want to be able to see that the teeth are fully seated in the morning reprogrammer. Once this is set up, or even while it is setting, we check once again with our shim stock to make darn sure that the occlusion is still holding shim stock. After this is done, we have a nice little record, if you will, of the lower front teeth and where they were before we fit the appliance, and the upper front teeth. Again, the patient using this at home, they're going to watch for their upper front teeth seating perfectly in the morning reprogrammer. They will be able to tell with that if their bite is changing. They will also be able to feel that their back teeth are touching. That's why the shim stock. So I feel it's very important to make sure that the person can feel that they have proprioception of posterior contact. So the least side effects, the way to have the least side effects, and particularly posterior open bite, is to have the patient start at the records appointment. What do you mean? So the vast majority of us, absolutely probably 99.9% of oral appliances for sleep apnea and snoring that are fit today, if the dentist does anything at all to help the patient get their bite back, they will give them something at the fitting of the oral appliance. This is traditionally done. We give it to them when we give them the oral appliance. And I'd like to change that because that's a lot of stuff for the patient. They're getting this new big device. You're explaining to them how to adjust it, perhaps. You're telling them that it's going to take a while to get used to. You're explaining how things work. And then you go through all these side effects that they might have and how they can avoid it. So one of the things that I've talked about for years, and one of my Spencer Study Club members, Jessica Sabo, made these beautiful clings that she gives to her patients that say, floss like a boss, check your bite every night. Okay, the floss like a boss part is if your patient will floss their teeth every day, they will notice if their teeth are separating, which is another potential side effect of oral appliance therapy. So if every day it's snap, 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 and then one day it goes to slide, slide, then they know, uh-oh, something's changed there. The goal with that is to catch the problem at the level of microns rather than millimeters. If somebody comes in and says, I'm catching meat between my teeth on the bottom, this is a problem. If they say the floss isn't snapping quite like it used to, this is a much less of a problem. And then check your bite every night. Now, why at night? So if they use this morning reprogrammer in the morning, that's to get them back to their normal occlusion. So by the nighttime, for sure, they should be able to tap, tap, tap. My bite is the same as it was yesterday. If a night or two goes by, they're like, wait a second, I don't feel my back teeth like I should. Then they call you, and then you engage them to help them get their bite back. Okay, so this is what these look like in somebody's home. They can put that on their mirror there to remind them to every night, floss like a boss, check your bite every night. If you give the patient the morning reprogrammer and this type of instruction to start at the records, they start using the morning reprogrammer the next day. They start flossing like a boss and checking their bite every night the next day. When they come in to get their oral appliance, which may be days or weeks away, you can ask them questions like, hey, how's it going using that morning reprogrammer? Can you feel what your normal bite feels like now? Do you recognize what that is like? And they will say, well, yeah. And also there's a little bit of a psychological advantage there that they've started treatment. They're not waiting for 2 to 3 weeks to get started. They're already started. This is the preview of coming attractions. This is the here's what I need to do now. And maybe if your practice does anything with myofunctional therapy, things like that, you could start those exercises now too. They don't have to wait till they get their oral appliance to start the myofunctional therapy. All sorts of cool stuff that we could do here. Positional therapy. All of these things could be started now at the records rather than waiting for them to come back and get their oral appliance. If you do that, I can virtually guarantee you that patients that use their morning reprogrammer, the patients that floss like a boss, will not have those side effects that people have dealt with for years and years and years because we weren't doing it this way. Okay, and last is the highest ROI revealed. Well, you probably know this one too. The highest ROI that you're ever going to get is in educating yourself. You are probably a dental professional watching this video, unless you just got on my mailing list somehow by some other means. And you've invested tens of thousands, if not hundreds of thousands of dollars in your education at this point. And you continue to do so. Or again, you wouldn't have been in one of my courses or things like that. And you do that because you know you get a return on investment. And as we go from where you are now to where you want to be with regard to sleep and TMD in your practice, there's some steps that we need to take which will be familiar to you with anything else you've ever entered into your practice or brought into your practice. So first, we have education for yourself. That's where it starts. You have to know this is something I'm going to be passionate about. This is something that I'm going to stick with and that I really want to do to help my patients. Next, you need to educate your team. How many times have you gone to a course, gotten excited about something, come back, and the staff's like, oh my goodness, no, we are not excited about that at all. They're like a little bit nervous that you're going to do something crazy or that you're going to go down some direction that doesn't make sense for the practice. Oftentimes that education for your staff needs to come from someone else, and someone who does that for a living to get them excited about that just like you are excited. Then after that's on board, you need systems and tools. You may want to help somebody with sleep and TMJ problems, but you don't know how. You don't know how to working with the medical field. Sleep and TMD are squarely on the medical side. There's sometimes insurance issues and other things. So you need the systems and tools to help you do that. And speaking of insurance, billing and business. Now, regardless of where you are in the world, I've never met anyone that doesn't have some sort of governmental or payer type of issues, regardless of what country they practice in. So this isn't an American thing. I mentioned Medicare before, and that is something with those oral appliances that we talked about. But Spencer Study Club, we have members all over the world. And why that is because the business aspects of sleep and TMD are similar, and also even some of these billing things that we talk about. So getting squared away on how do we do that. And good news there, for most of you watching this right now, you don't really need to get that deep into medical billing to be successful in sleep and TMD. You really don't. Hands-on experience. You've got the knowledge, your staff's excited, you've got everything down, but now you need to actually help somebody. One of my big frustrations is there's a lot of programs out there, and sometimes these programs are super expensive, but the hands-on is either zero or super minimal. You're a dentist. I'm a dentist. We went through tons of hands-on. Our first 2 years was doing stuff on plastic and whatnot before they would unleash us on patients. That's our model. We need some experience before we are going to consider trying this on our patients. So that is one of the things too that you will need to seek out is, where do I get this hands-on experience? Mentoring and guidance. You've got the hands-on experience. Now you go out there and, like most of us dentists, you probably practice as an island. You probably are either a sole proprietor or you've got a few partners, and they may know nothing at all about sleep and TMD, have no desire to learn anything about sleep and TMD. So how do you learn other than just by doing? And you'll always feel like, gosh, I know that there's someone else who knows this. I wish I had a mentor and some guidance in this area. Next, we have continuing education. None of us are done once we get our initial education. You know that. So where can you go to get something that's timely and up to date and looking for the latest stuff that's going to help you help more people? And that goes along also with continued coaching, knowing what you should maybe pursue and what you don't necessarily need to pursue. And all of this together, this whole pathway, is how you get from where you are now to where you want to be. And why I developed Spencer Study Club was to give the greatest value possible. There are a lot of things out there that have very high costs and sometimes have very little value. There are some things out there that are basically free but have very little value also. So the idea behind creating Spencer Study Club was to give something to the world, if you will, that would provide dentists around the world a way to affordably get into sleep and TMD and have all of these aspects covered. And that is why I created it. And Spencer Study Club is a series of modules and online content and coaching, mentoring, hands-on courses, things like that, which I will go over now in more detail. But before I do so, I wanted to give you a gift for hanging out with me this long. And I hope that this is something that is very valuable to you. I had the slide there on the internal derangements of the jaw joint. You've probably seen that before. Maybe you understand that pretty well, maybe you don't. But I find that one of the most difficult areas of dentists that are interested in helping people with sleep apnea is they're very, very concerned about temporomandibular disorders, and rightfully so. So I'd like to gift you a flow chart that I made for Spencer Study Club years ago. And I believe that this flow chart can really help you improve your diagnosis of temporomandibular disorders. And what this goes through is you start off with the patient pointing basically to where it hurts, and then you can take them through this flow chart to come up with the probable or possible diagnosis, and then go from there. Diagnosis is key. Oftentimes with temporomandibular disorders, the diagnosis is, well, they sort of have TMJ or muscle pain or whatever. Here's a night guard, good luck. And then if the night guard isn't successful, like, well, I don't know what happened. Let me send them to sort of a TMJ specialist or something like that. I think that this flowchart will really help you as it takes you through initial diagnosis, and then you can more clearly create a treatment plan that will more than likely be effective based on your diagnosis. So go to jamiesonspencer.com/TMDflow to download that free flowchart as my gift to you. And thank you for being with me thus far. I hope that you have gotten value out of this. And now let me, if you will, go through what is involved in Spencer Study Club and how can you be involved if you'd like to be. So here's kind of the big picture overview. We have 5 different levels of pre-recorded content that I've built. Level 1, getting started saving lives. This is sleep and TMD basics, goes from anatomy to Z's, I like to say. Level 2 is confident clinical care. This is taking you with a patient for sleep apnea from the initial screening to the final follow-up with everything included on how you do all of those little steps. Level 3 is totally TMD, and that's a little 80s phrase there, so totally TMD. And here I go into depth on all aspects of treatment of temporomandibular disorders, from injections outside of the mouth to splint therapy, using a day splint, using a different night guard, what types of appliances, how you figure out the position of the jaw with splint therapy. And again, this is something I find that a lot of dentists are very uncomfortable with. I don't know about you, but I was the only one in my class that fit a night guard on an actual patient. The only one out of 55 of us in my class, I was the only one that fit a night guard. I talk to dentists all the time and ask them, did you fit a night guard on an actual patient in dental school? And the vast majority haven't. Maybe you did. But even that patient, that was for bruxism. That was to protect their teeth. It wasn't to help them improve their TMJ problem. So most of us, very little experience, and this module will make you more comfortable there. Level 4 is expanding your impact. This is kind of the business module to go through internal and external marketing, how to work with your medical colleagues, and how to really build sleep and TMD into your practice. And then last is deep into sleep, where we go into all of the different things that can cause people to be sleepy besides a blocked airway. So there's more than just sleep apnea that could cause people to be sleepy. And this is where we talk about medications and insomnia, and again, all of these different things that are not sleep apnea. Okay, so let me go over these in kind of a little more detail here. Level 1 is all the basics and not so basics of dental sleep and TMD. The goal with level 1 is to help you master the basics. I know some dentists and they're always going to courses, course. But then when I talk to them, I realize that they haven't really mastered the basics. Mastering the basics is the key to being able to then launch into more sophisticated levels of care. So level 1 is all about the basics, getting down to the root of anatomy and why these problems happen. And this is important too, so that you can train your team and maybe use this also as a training tool as new staff members join you. Level 2, this is everything you need from screening to final follow-up. The goal here is to help you increase your cases. Maybe you are seeing a few sleep apnea patients now. I mean, you're seeing lots, but maybe you're treating a few. You see sleep apnea patients every day in your practice, but maybe you don't know how to get them to get a diagnosis and then what to do afterwards and things like that. This is the level that goes through all of this. The goal here is not only to increase the number of cases, but also to increase your success rate and do this all profitably. One of my great disappointments with our field and a lot of the education in our field is that dentists end up having a very expensive hobby. They don't have a profitable sleep and TMD aspect of their practice. They just have a expensive hobby, and that is not our goal. If there's no money, there's no mission. I want to help you be profitable with this, as well as helping all the people that you will. Level 3 and totally TMD, this is designed to help you feel more confident with your sleep patients, because a lot of dentists get into this through sleep first, and they're worried about causing TMJ problems, exacerbating TMJ problems. So this should help you worry less about that as you understand these problems more. Help you feel more confident helping people who are suffering with TMJ problems, like the woman I talked about earlier today who says, hey, I have a TMJ problem. And then lastly, just helping you feel more comfortable with all of your patients. One of the greatest nightmares of a dentist is a patient who doesn't have a jaw problem. They come in and have a long procedure or something like that, and then the next day they report that they have jaw pain or they're having difficulty closing or something like that. And you've created this TMJ problem through this long procedure. That's no fun. On the other hand, if you understand what's going on, you will be more confident in, hey, I get it. Here's what we're going to do to take care of this for you. Okay, level 4. This is the kind of all the different practical tips and tricks that I've learned over the 24 years of internal and external marketing. In addition to my limited practice in Boise that I went into right out of dental school, I've helped a bunch of other practices around the country, including I lived in North Carolina for 4 years, where I helped a large group practice of over 30 practices add sleep and TMD to their big group. In addition to that, I've helped dozens of other dentists around the world increase sleep and TMD in their practice. So that's what this level is about, is how to do that. And at the same time of increasing it, doing so in a way that improves your relationships and your reputation in your own town. That's key. There's a lot of systems and courses out there that have these kind of ways to go around the local medical community. That's not this. My goal is for you to be respected in your own town, to be part of your local medical and dental community, not try to go around them. And then last is level 5. Again, all of the things that can make somebody not feel better. You're going to have plenty of patients that you treat them with an oral appliance. Their sleep apnea is eliminated. I mean, sometimes the AHI will go to 0, literally, but they still feel tired. Well, could it be their diet? Could it be the caffeine? Could it be the medications they're on? This is where we jump into those categories. And this is not just important for your patients, but also for your family. And speaking of family, this is my family, actually, though a little bit smaller than my family, because this little girl here just celebrated her 3rd birthday yesterday, and she now has 2 more kids. Her 3rd child, Kewani, it's my daughter-in-law Kewani, my son Josh. They just had their 3rd and our 1st grandson. And Carly here, who is pregnant at the time of this picture, that's Maddie, who is 2 years old. So we need to get another family picture, it looks like here. But the reason I bring up family is not only is my family involved in Spencer Study Club, but all of the sleep and things that we do, all of the sleep apnea things I've learned over the years, I use with my own family and my extended family. You know, my wife's mother is on a CPAP machine. Countless of my relatives have been diagnosed with sleep apnea or TMJ problems and treated. This is a family thing. My son Jefferson here, who is now taller than his older brother and quite the strapping lad now, he, if you've heard me present before, I talk about in my lecture that he had sleep apnea as a child and we missed it. And he got his tonsils and adenoids taken out and he became a different child overnight. So this is a family affair, and I hope that if you get nothing else out of Spencer Study Club than helping your own child, would that be worth it? If you got nothing else out of joining Spencer Study Club than helping your spouse or helping your parent, would that be a reasonable return on investment? I think it would, but we're not going to stop there. We're going to expand that influence throughout your whole community. So what all is included? So I've mentioned these 5 different levels. That's all on-demand video. So over 48 hours of AGD-approved on-demand CE that you can just watch anytime you want in any order you want. In addition to that, we have webinar-style content that is, again, this on-demand. You can listen to it. You can read it through transcripts. All of this is set up in such a way that any way you want to learn, you can learn. The transcripts is over 800 pages, I think it is, and don't let that freak you out that it's so much content. But what's nice about that is you can also search the PDF of the transcripts. Many of our members will have the transcripts there to take notes while they watch the videos. There's the audio downloads that you can listen to while you're driving to and from work. So we've made this really easy for you to consume. Any way that works for you, sitting on a beach or driving in your car, you can take advantage of this content. All of that is included in your annual tuition. Now, let's compare Spencer Study Club and this content to some other stuff that you might consider, like taking a weekend course. Now, there are many weekend courses out there on sleep apnea. I teach a lot of them myself. But I came across one recently that was a good course. It was 2 days, so 16 hours of CE, and it was $1,800 or $1,795 for the dentist to attend. And that's a little bit on the higher end, but the reason it was a little more expensive is these people weren't selling you anything. They weren't selling you cone beam CTs or equipment or oral appliances or any of that stuff. It was just pure education. And I'm sure that you've come across courses that are more expensive than this or less expensive. But let's just use this as an example. So $1,795 for the dentist. It was $495 for the staff member to attend with the dentist. Then, of course, you'd have travel costs, hotel, food, paying your staff, all that kind of stuff. So let's say we've got one dentist and 3 staff members. So that would be in total for just tuition, $3,280. If we add in our travel, hotel, food, and pay, we get roughly another $3,000 for a grand total of $6,334 for a single weekend. Now you might get a nice notebook or something, although nowadays you usually don't because they have stuff online. Maybe you have access to that online afterwards. But are you going to look at it? Have you ever? Maybe you have. That's awesome if you do. And you'll take advantage of that with Spencer Study Club too. But then the other bummer is maybe one of those staff members that you took is no longer with you 6 months from now, and you made that investment, but now you basically just trained someone else's assistant. So now let's compare that to Spencer Study Club. So at $6,334 divided by that 16 hours, that's $395 per hour of content. So if we extrapolated that to Spencer Study Club at 48 hours, I would need to charge you just over $19,000 just for that content, just for the educational content. We're not going to do that. Now, how about we compare it to an online program? Because there's a bunch of those out there too. So the problem with other online programs is most of them are super superficial. They just get you started. It's just beginner stuff. As a matter of fact, I have online programs through Glidewell and other places that are basically free. And you can indulge in those and they're good, but they're only going to take you to the, all right, now I've got just the basics. Many are super expensive, or they are sponsored by someone who's trying to sell you something probably super expensive. And there are who knows how many dentists out there with equipment in their closet that they never use that they picked up at such a course. And, you know, it kind of always makes me think like, you know, the NASCAR drivers and they got their car and it's got 1,000 logos on it. You ever feel like that when you go to a dental meeting or something and it's like sponsored, the speaker's sponsored and they're all talking about that stuff? So that's not what Spencer Study Club is. There are no sponsors. We do have some companies that we give you discounts with, but there's no sponsors. We say what we want around here. We're very open on that, and there's nothing to sell you as far as equipment, things like that go. I'm known as the low BS guy, where BS stands for, among other things, buying stuff. You don't need to buy a bunch of stuff. The biggest complaint I hear about the online stuff is that it's just super boring and people can't get through it. As a matter of fact, I've heard stories of people taking some of these programs online and literally because the system made them go through the modules or it wouldn't give them credit, they would start the module and go to sleep. And that way they would get their credit. Now, you know, that doesn't make anybody feel good, right? They didn't get anything out of it. But what they told me was I wasn't getting anything out of it anyway. So I might as well get the CE. I disagree with that. And hopefully you've enjoyed this interaction with this video. This is how Spencer Study Club works. It made basically the same way. Now, I need to also compare to some of the scumbaggery that's out there in this field. There are a lot of programs that are selling get-rich-quick schemes. There are franchises you could buy for $250,000 that will supposedly get you to where you want to go faster. There are secret models, there's magical appliances, and more and more and more. And most of these things cost anywhere from $75,000 to, again, hundreds of thousands of dollars. And unfortunately, a lot of these also come with techniques and strategies that are flat out illegal, at the very least unethical, and if you're lucky, you won't lose your license, you'll just lose your reputation. I have probably at least a dozen members of Spencer Study Club who went down one of these paths, lost tens of thousands, if not hundreds of thousands of dollars, and then found their way to Spencer Study Club, where they were able to get content that actually helped them rebuild that reputation. Okay, so how much is all this stuff? So the annual tuition in Spencer Study Club is 3 monthly payments of $1,750, or something we've added for this is 6 monthly payments. I don't know if you've heard, but a little bit of a recession going on and some inflation. And the inflation part, we've not increased our fees in Spencer Study Club, so that's cool. But the recession part is something that you should take seriously. And also one of the reasons that this is so important for you to do now. The return on investment that you will get from educating yourself will be the best return you ever get on any investment. And this education, now note here, annual tuition. I always get questions like, so is it annual? Yes, it's annual. So you may be like most of our Spencer Study Club members, and you continue this membership for years and years and years. The vast majority of our members have been with us years. On the other hand, you may not. You may do 1 year and you feel you've really got it and you're doing it the way you want to and things are going great. But with that, even a single year investment, how many people can you help? What kind of ROI can you have? And then extrapolate that for the rest of your career, because that knowledge that you gain, you get to use over and over and over and over again. The reason that most of our members stay on year after year, I'll get to in just a second. But again, 3 monthly payments of $1,750 or 6 monthly payments of $875. That's just half of $1,750. Or if you want to save a couple bucks, you can do a single payment of $5,000. You can right now go to jointhestudyclub.com and go ahead and get signed up. But all that stuff that we've covered is included in that annual tuition. Now, in addition to that, I want to give you a few bonuses. As a matter of fact, 6 bonuses. So here's bonus number 1. Bonus number 1 is that up to 5 of your team members will also get their own logins to Spencer Study Club at no additional charge. Also, they will get CE credits. So if your hygienist or even your certified dental assistant needs CE on an annual basis, just like you returning your quizzes that you'll take at the end of these modules, they as well will be able to collect CE credits for going through this. Now, take that into consideration. If you're already paying for your team members to get CE, you probably have that expense already. You can now put that into this at no additional expense. So up to 5, they get their own login so that they can keep track of where they are, so they can do the CE. That is included at no additional charge. Bonus number 2 is our document center. Now, frankly, this alone is worth way more than $5,000 because this took probably $500,000 literally to build all of this over the years. So this is all of the different documents that we use in our limited practices. Again, paying somebody to do this would cost you tens of thousands of dollars, and we've done it all for you. So all of these are in Word document form, and you can just modify it, change anything you want, put your letterhead on it, and use those forms to have the systems in place to run this in your practice. That document center is updated from time to time and additional things are put in there. All of that is included in your annual tuition as well. Bonus number 3 is perhaps my favorite of the aspects of Spencer Study Club and the reason that the majority of our members stay year after year after year, and that is ongoing mentoring. So the core content is important, and our members tell me all the time that they're going back and reviewing it. As a matter of fact, even when I show up and speak live somewhere for somebody else, like I was speaking at Glidewell a couple weeks ago, and I had 3 Spencer Study Club members in the room, and I'll joke with them. I'll say, hey, you know that you've got access to this content, but they say, well, you know, we get a little bit extra when we're live with you, or somebody asks a question that we hadn't thought about, or whatever. So if I only had the online content, that'd be okay, but you really need ongoing mentoring. You really need to be up to date on things and able to make decisions as things change, not only in the field, but in the economy and with everything else. Like, for example, with COVID and stuff, we had to make a lot of changes, right? And Spencer Study Club members were protected during that period, and we had content for them specific to those issues. So some of the things we do, we have monthly Zoom meetings with all of our members. These are also recorded. We have a secret Facebook group that is very robust and popular. A day does not go by that there aren't multiple posts, most of them of a clinical nature, of people asking questions about a case, and then the Spencer Study Club members asking them questions. Have you thought about this? What are you doing with here? What did the patient say about that? Now, unlike a Dental Town or some of the other forums that are out there, the special thing about this secret Facebook group is we're all on the same page because we have similar background knowledge from the videos and from working together. And also, I teach in a Socratic type of method where I ask questions to help you learn. And this is how the Facebook group is. So again, instead of like being on other dental forums where typically a dentist will just tell you exactly what to do because they're so smart that they're just immediately going to go to what to do. In Spencer Study Club, the more common scenario is you ask a question about a patient and then others will ask you more questions of what have you thought about and have you talked to the patient about this. And then we'll also help you derive a tentative diagnosis and a treatment plan and then help you along with that. So imagine having hundreds of colleagues that you could contact at a moment's notice and they would reply to you very quickly. That is our Facebook group. It's amazing. Now, we have been doing this now for actually 6 years. And so you've got 6 years of searchable posts. So that's kind of fun too, because almost anything you can imagine has been brought up in the Facebook group over this past 5 to 6 years. So if you go into Facebook, if you know how to do this, there's a search forum and you put in a topic like, let's say, disc displacement or how to read an MRI or something like that, it's going to come up. And so you can almost instantly, it's like the biggest frequently asked questions forum ever in the world because you can just go in there, put in whatever you are wondering about, and almost assuredly it's been discussed before. And then you can look on that and let's say that it has been discussed before, but what you're looking for wasn't. Then you can actually even comment on that. And if it was 4 years ago that somebody posted that, that's going to bring it up to the very top, renewed afresh, and you will get new insight on that. So amazing feature there as well. We also have a monthly physical newsletter that gets mailed to you. This is limited to our US members because of the costs of shipping around the world. So for all of our other members, it's digital. But for our US members, you will actually get a physical newsletter every year. A ton of our members tell me how much they enjoy that, how much they enjoy having something physical. You know, it's nice to get off the computer from time to time. And this is something that you get every month that will be timely. This is the musings that I'm going through now. I have other authors come in and post in that as well. Again, our members tell us all the time that that's one of their favorite things. And then we also have discounted live events. So our Spencer Study Club live events are for members only. We will have speakers that aren't members, but the events themselves are for members only. The cool thing about that is our speakers always start off at a higher level, because they know they don't have to define what an apnea is. They don't have to define what a reducing disc displacement is. They know that you are at a higher level, so they start there. And the quality of lectures that we get are phenomenal, second to none. From maybe the same person you saw speak somewhere else, but they're going to come in at a completely different level for you because they know the education and background that you have. All of this is included in your annual tuition as well. Here's a group picture from one of our Spencer Study Club events. It was in San Antonio. During COVID, as I mentioned, we had to kind of shift gears a little bit, and we put together our Global Dental Sleep Medicine and TMD Virtual Summit in 2020. During that kind of hard period too, we had additional webinars. So we didn't just do our monthly, but we did these on an almost weekly basis, what I called our money and mindset mashup, to help people with this ever-changing rules of employee retention credit and all sorts of things that were going on, as well as just the mentality of how do I do this? How do I work through this pandemic? We have hands-on courses that are given virtually nowhere in how to give extra oral injections like jaw joint injections. We're teaching how to do PRF and PRP and Botox to help with regenerative TMJ therapy. There are very few of these courses taught in the United States or in the world, And again, the unique thing about our courses is in the same amount of time that someone else might have for similar fees or usually discounted fees, we're able to start at a higher level. Because prior to showing up for one of these injection or PRF Botox courses, we say, hey, please review these videos in your Spencer Study Club library so that you come in knowing that anatomy. We really don't need to review it again because you've got all of this background. Whereas if you go to somebody else's course and you show up, there's usually that one person that did no preparation, that doesn't really remember anything, yet has the the trait of asking questions every 5 minutes and kind of derails the entire course. That doesn't happen in our programs. Just recently, we had our Spencer Study Club live in Dallas. We always have a course the day before the American Academy of Dental Sleep Medicine's annual meeting, and had incredible speakers there. Steve Carstensen, John Remmers, Keith Thornton was our keynote for the evening discussion, and a bunch of our Spencer Study Club members going over clinical pearls that have helped them in their practices. And we have a good time as well. This was at our Spencer Study Club in Dallas, so hence me and the cowboy hat and with the big Spencer Study Club belt buckle and stuff there. And that's Eddie the Yeti, or actually Betty the Yeti there, who passed around Yeti coolers to everybody. And this is a point that if you don't like to have fun, you should not join Spencer Study Club. In the videos themselves, I'm more like this. I'm a little irreverent. I'm not super, going. It's not going to be slide after slide after slide of literature. If you're going for that, there's other stuff out there for you. If you really want to have fun, be surrounded by colleagues that have the same vision that you do, you want to help as many people as you can, then welcome to the club. That's the kind of club this is. Okay. Another bonus is that we have discounts with various vendors, and these come and go and depends on what's going on at the time. Like, for example, a few years ago when people all started scanning, the members are like, hey, is anybody else looking at the Trios or the Medit? And we would reach out to those companies, and in every case where we've ever done this, the companies are more than eager and gracious to offer a study club discount. Usually these discounts for equipment are in the 10% range. So when you're buying something that's $20,000, you could save $2,000 just by being a Spencer Study Club member. Burkhart gives discounts for just their basic dental supplies and whatnot. If you actually took advantage of all of the Spencer Study Club discounts that are out there, you would easily pay your annual tuition just through those discounts. All of that included at no additional cost. Now, these newsletters and the Zoom meetings, I didn't mention this, but these are also all archived. So you joining in 2022 are getting the advantage of years and years and years and years of this mentoring group content already occurring. So you will have access to all of this backlog, all of the archives of these meetings. Now, again, not to freak you out, but that's over 1,800 pages of newsletter content and an additional 80 hours of video content from our monthly Zoom meetings. This is all archived in such a way that you can easily find it, and the PDF from the newsletters is something you can also search. So again, regardless of what you're trying to learn, it probably is already there. And if there isn't for some reason, that's where you go to the Facebook, ask a question, and definitely there's going to be a member or myself personally that's going to respond to that and help you out. That's all included in your annual tuition as well. And last bonus is access to new recordings. So I've mentioned multiple times here, 5 to 6 years we've been doing this, and it's time to kind of refresh the content. Now, the vast majority of the content in Spencer Study Club is evergreen. The anatomy hasn't changed much in the past 5 years. Apnea-hypopnea index, they've not changed that definition in the past 5 years. So a lot of it is just as relevant today as it was when I recorded it initially. However, I am in the process of going through all of the content and re-recording it, as it were. Level 5 will be one of the ones that changes a little bit more because there's new information that has come up in the past 5 years. And plus, I will be incorporating some of my colleagues, John Remmers, Noah Siegel, in that content as well. So as soon as that content is available, which hopefully will be by the end of this year, you will have access to all of the original content as well as the new content, no additional charge. That will also mean additional CE credits available, although, 48 in a year is probably plenty for you. But for those who stay on additional years, that will be additional CE credits that they will have available to them. Of course, this is also included in your annual tuition at no additional charge. Now, all of these bonuses will go away and open enrollment will close on Thursday, August 18th. So please go to jointhestudyclub.com and act now. I will send out a few reminder emails and whatnot, but we only do open enrollment twice a year. So now is the time to join. The next open enrollment will be in December, but that doesn't mean that these bonuses will be there, and also doesn't mean that we won't raise the fees. It's kind of tough to keep offering things at the same rate when all of us are paying so much more for everything, including employees and everything else that we do. All right, so here's the deal. You're still watching this, you're still with me, and I want to really confirm who this is for. So I am not looking for fans. I enjoy that people like my lectures. I enjoy that kind of stuff, but I'm not looking for fans. Couldn't care less about that. I'm also not looking for cheerleaders, for people that are like, yay, sleep, that's really cool, and TMD, that's cool. I'm not going to do it, but I'm all supportive of those of you who do. I mean, that's okay, I guess, to be that and to be someone who just wants to learn. But really what I'm looking for is players. Not fans, not cheerleaders. I want players. And players are dentists and their teams who are actually going to implement what you learn to help people. Again, my goal and vision in my life is to add 100 million years of life lived with vitality. I do that through helping you help more people live with vitality. So if that sounds exciting to you, I hope you will join us. And if you don't know me very well, I want to also give you a satisfaction guarantee. Normally we do this for 90 days to give you plenty of time to get through as much content as you want. And if there, for any reason you don't like it, you just let us know and we will refund that money. And now we've extended that to 6 months. So you'll have a full 6 months to go through the content, 180 days, to make sure that it's for you. Now, we have very little experience in giving people their money back because people don't ask. As a matter of fact, the reason I brought up that thing about having fun is the last person, and I think, again, I can count on one hand in over 5 years the number of people that have asked for a refund, and usually those were all hardship cases where something terrible happened right after they joined Spencer Study Club and they needed those funds back. But there was a person who asked for a refund because they didn't basically like the fun atmosphere of Spencer Study Club. They're looking for something a little more serious. And don't get me wrong, there's plenty serious here, but we do like to have a good time. And again, if you've been with me in my other lectures, you know that that's how I teach. I like to be entertaining as well as educational. So if you're that person, if you're all stuffy and stuff, maybe don't join. But if you're just not sure, you don't know me that well, there is a 100% refund satisfaction guarantee for 6 months. And I want to just kind of end here talking again about this return on investment. We're in tough times financially. You may be doing okay. Most of us dentists are doing kind of okay because of some of the, especially in the United States, because of some of the financial things that we had, through government money that now is kind of biting us because of the high inflation and whatnot. This is affecting all throughout the world. Your patients are going through things. But the return on investing in yourself will always be your highest return. If you have been wanting to implement sleep and TMD more in your practice, if you have been wanting to know how to do that, to be comfortable doing that, to not have to worry about making somebody worse, invest now. And I promise you, your return on investment will be one of the greatest returns you've ever had with any educational pursuit that you've ever had. I can promise you that because that is what I hear from our Spencer Study Club members on a regular basis. Okay, so once again, to recap, to join the study club is 3 monthly payments of $1,750, or you can stretch that out to 6 monthly payments at the exact same amount. Or if you'd like to save a couple $100, one single payment of $5,000. When you go to join the study club, it will have those different payment options for you there. 48 hours of content. You can watch it, read it, listen to it, however you want to learn. It's there for you. And then in addition to that core content, we're throwing in the following 6 bonuses. Number 1, 5 team members included at no charge. 2, you get the full document center that you can modify the documents in any way that you want. 3, you get all of the aspects of the mentoring group. That is the monthly newsletter, the Zoom meetings, invitations to the live hands-on events. All of that is included. 4, group discounts. 5, all of these years of archives of our newsletter and our Zoom meetings. And number 6, as the new recordings are released, hopefully by the end of this year, you will have access to those new recordings as well. And as you stay on for additional years, that means even more access to CE credit. So I invite you to go to jointhestudyclub.com right now and join us. Again, I know that you will have the highest return on investment that you've ever had with regard to an educational pursuit. And perhaps more importantly than that, you will join a group of colleagues that are engaged in the greatest good of helping patients throughout the world. And in Spencer Study Club, we talk a lot about the ripple effect. And I want you to think about that. With each person that you help, ripples go out from them. That person is a father or a mother, a daughter or son, a husband or a wife. They have connections. They are an employer or an employee. They're working in jobs sometimes that are dangerous. They have employees that are doing things. And as you help them sleep better, as you help them get out of pain, they become different people. And those ripples go out and out and out to all of those that they come in contact with. And you will never completely understand the impact that you have had on this world, on the people of this world, by helping these people. And once again, what if that one person you helped was a loved one? What if going through all of this content, you got one pearl that helped you help your own child or help your parent or help your spouse? Would that be a significant return on investment for you? I bet it would be. So I look forward to meeting you. We have, by the way, some incredible courses coming up that you would be invited to if you join Spencer Study Club now rather than waiting till December. So we have a Spencer Study Club live event that will be in November. That will be down in Irvine, California at the Glidewell headquarters, actually. It's going to be amazing. And we're going to be talking about regenerative TMJ, which we're really excited about, not just treating, and stopping the progression of temporomandibular disorders, but reversing them, which is super exciting, as well as regenerative sleep. So not just opening the airway, but getting people sleeping better in all aspects of their sleep beyond just opening the airway. So that's going to be in November. We also have a hands-on course in how to do PRF and Botox and splint therapy. That will be in December. You will be able to access those courses as a member of Spencer Study Club. They are not available to non-members of Spencer Study Club. Okay, well, I hope you found that enjoyable. Take advantage of your free gift. Go to the flowchart and get that flowchart. I think you will really find that valuable in your practice. And I hope, again, to see you at an upcoming Spencer Study Club event or on our Zoom meeting, and that this will inspire you to get out there and help more people, regardless of where you are in your practice now, whether you've never treated anybody for these problems or you're treating a bunch. Our Spencer Study Club members range from, again, total beginners to people with their diplomate and their boards and orofacial pain specialists and orthodontists, and you name it, we've got it in Spencer Study Club, and we'd like you to join us. All right, take care.